Hi, and welcome. My name is Dr. Kareem Watson. I'm the Chief Engagement Officer for the NIH All of Us Research Program. It is my pleasure to be here for you this evening to welcome you to this event and this conversation. It's so important for the All of Us Research Program to continue our value and our mission of engaging populations who have been historically underrepresented in biomedical research. And part of ensuring those populations who've been historically underrepresented in biomedical research is ensuring that we engage populations in what we call engagement across the lifespan. And across the lifespan, of course, means that we are vitally interested in the engagement of pediatric populations in precision medicine research. We started this journey by making sure that we identified an amazing leader in Dr. Sarah Vandries that will help lead this work as Director of Pediatrics for the All of Us Research Program. We also know that this effort is so important that one of our mission and our values is to ensure that we work with communities, listen to communities, and convene communities to hear your priorities in this work. As a result, we've had several community engaged listening sessions. We've had with pediatricians, partners, parents, and families, and all the other ways that we know families are designed and implemented across the US. And as a result of that, we've gotten a lot of guidance on how we should make sure as we open the door to pediatric enrollment, that we do it in a way that is responsive to the needs and priorities of communities, particularly those who've been underrepresented in biomedical research. So this evening's conversation is another one of those steps forward in how we address how do we apply what we've learned. You'll hear from our Director of Pediatrics for the All of Us Research Program, and you'll hear from one of our community partners and our community advocates and pediatrician partners as a part of our advisory board as well. Thank you all so much. I look forward to this evening's discussion, and thank you for being here.
Thank you very much. And I'm very excited about this particular program with over 73 million individuals under the age of 18. We have a tremendous opportunity. And I'm overly thrilled, thank you, Dr. Watson, with the talent that we have with us today to present at this particular program. I'll introduce them together, and we will hear from several of the speakers, and then we will go into an interactive panel discussion with our panelists. First, let me introduce Dr. Sarah Vandries, who serves as the Director of Pediatrics for the All of Us Research Program. And in this role, she leads planning for future enrollment and retention of the pediatric and adolescent participants who reflect the diversity of the United States. Before joining the program, Sarah served as an associate professor of pediatrics and medicine at Vanderbilt University Medical Center. There, she was director for the Vanderbilt Center for Pediatric Precision Medicine and founding director of Genomics and Therapeutics Clinic. As a physician scientist, Sarah routinely used clinically related and generated data and biosamples, both for research and for implementing tools for personalized medicine in clinical practice. In addition to her research career, she is a pediatrician caring for infants, children, and adolescents. Sarah completed her MD degree and PhD at the Mayo Clinic College of Medicine and her pediatric residency as well, and is a clinical pharmacology fellowship at Vanderbilt University Medical Center. She is an active member of the Society for Pediatric Research, the American Society for Clinical Pharmacology and Therapeutics, and the Pharmacogenomics Global Research Network. What a tremendous individual. We also have Dr. Rachel Chatters, who is a board-certified pediatrician with more than 20 years of experience specializing in pediatrics and adolescent medicine. Dr. Chatters is a graduate of the University of Alabama, Birmingham School of Medicine, and completed a residency at the Children's Hospital of New Orleans. Dr. Chatter continually strives to improve the health of children. She served as preceptor at the William Carey University Osteopathic School of Medicine and as the president of the Louisiana chapter of the American Academy of Pediatrics. She is affiliated with the Lake Charles Memorial Hospital, main campus, and Crispus Ochsner St. Patrick Hospital in Lake Charles, Louisiana. We're also thrilled to have with us Dr. Stephanie Abazi, who completed a Bachelor of Science in Public Health at Baylor University and received a Doctor of Medicine from the University of Texas Medical Branch at Galveston, Texas. Dr. Abazi is currently completing the second year of residency at LSU Pediatric Residency Program. Upon completion of her pediatric residency, Dr. Abazi will pursue a career in ambulatory pediatrics with a special interest in refugee and migrant health and health disparities. And lastly, but not least, Dr. Kimoyo Harris Williams is a board certified pediatrician and a fellow of the American Academy of Pediatrics. She is a strong health advocacy individual and empowers patients and their parents to be intentional regarding their health and wellness. And after receiving her Bachelor of Science degree in biology from Xavier University, she embarked on a research career in pulmonary critical care at Louisiana State University School of Medicine. She also received a doctorate of medicine from Louisiana State University School of Medicine and completed her residency as well. She is an advocate and a champion of the All of Us research program, and also serves as president and CEO for the KH Williams Enterprise, which is a health advocacy and equity corporation. What a tremendous group of speakers. I'm going to let Dr. Williams lead us off in our discussion on the pediatric engagement in this precision medicine. Dr. Williams.
Thank you so much, and good evening, everyone. Thank you for that warm welcome. It is indeed a pleasure to be here and a pleasure to share a brief but comprehensive overview of the NIH All of Us research program. Next slide. All of Us research program is a historic longitudinal effort to gather data from at least 1 million people living in the United States to accelerate research and improve health by taking into account individual differences in lifestyle, socioeconomics, environment, and biology. We hope that researchers will one day uncover paths toward delivering precision medicine or healthcare that is based on an individual. The All of Us mission is clear. It's to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care for all of us. This mission is being accomplished by nurturing partnerships with participants who make up the rich diversity of the U.S. We plan to do this with over 1 million or more participants for decades. By developing these partnerships, we will deliver one of the largest and richest biomedical databases that is broadly available and highly secure, thus categorizing all of us as health research by catalyzing a robust ecosystem of communities, researchers, and funders. This is being accomplished by a team that is committed to the culture of the program's core values. Next slide. The key words that drive the core values of all of us are open, diversity, partners, transparency, access, broadly, privacy and security, and lastly, positive change. The program is open to all adult populations, both UBR and all others. Our participants represent the rich diversity of this country and are partners, some of whom serve as participants on the advisory board, providing valued feedback and insight. All of us is committed to transparency, not only with our consortium members, but with the participants as well. Participants have access to their information, and the data can be accessed broadly by researchers. Security and privacy are of high importance, and the program promises to be a catalyst for positive change in health research. Next slide. So you may be thinking, what is asked of potential participants? Firstly, they must complete an informed consent process. Once completed, they can join the program as participants. Participants are invited to share their EHR, complete health surveys, and share a bio sample. Some participants are also invited to wear digital devices like Fitbits for real-time data. The data is collected and shared back with participants and with researchers. Next slide. Over 100,000 participants have received their genetic health-related results and disease risks, including disease risks and pharmacogenetic results. Next slide. Data is also shared with researchers, and as of January 2024, a little over 413,000 health surveys have been completed, with 45% from self-reported UBR populations and 77% from UBR overall. So what communities does all of us consider UBR are underrepresented in biomedical research? The specific categories include ancestry, which include race and ethnicity, those who select a single race other than white, or people who select an ethnicity other than those listed under the race of white. Age, which are people who are 45 years of age or older. Sex and gender minorities. Income, those who have an annual income at or below 100% of the federal poverty level. Educational attainment, those who are without a high school diploma or GED. Geographical location, those who are who live in established rural or non-metropolitan zip codes. Disability, those who have physical, functional, or cognitive disabilities. And health access and utilization, those who have inadequate access to health care, who have lack of insurance or no source of primary care. Next slide. So we have learned about the UBR populations and about all of us being open to all. Currently, most participants, next slide. Currently, most participants are between the ages of 18 years of age and 89 plus. So who's missing? Well, we have been waiting for a long time for the inclusion of pediatric participants. And as a pediatrician, I am so excited about the program making steps to start the pediatric protocol. I am thrilled to hand this conversation over to Dr. Sarah Van Dries, who is the Director of Pediatrics for the NIH All of Us Research Program. Dr. Van Dries will speak to us a little bit about the All of Us Research Program's pediatric protocol. Dr. Van Dries.
Thank you, Dr. Harris-Williams. Thank you for giving that wonderful overview of the All of Us program from such a high level. And thank you to the organizers for having this webinar and for each of you who are participating today. It's so great to be in this context. As Dr. Watson alluded to, we want to make sure that we're hearing from and having conversations with folks to get input about the program. On the pediatric front, on one level, we're just getting started. And so we want to make sure that we get input early and often. So I hope that this will be not a one-time affair, but that we can continue this conversation in the future. So if we can just go ahead and pull up the slides, starting with the pediatric activities update, we can dive right in. Perfect. I think for many audiences, they don't ask the question, why? Why do we include kids? Because it's obvious to them that if you had something that was of benefit, if you had opportunity to make health better, then of course you would include kids so that we can impact their lives in a positive way. But there are those who ask these questions. Why do you need kids in this program? Can't you do it just with adults? And the answer in my mind and in many pediatricians' minds is no. We have to include kids in order to live up to the all in all of us, in order to make sure that we understand things across that whole lifespan that Dr. Watson spoke of, and to do right by our pediatric citizens, to enable discovery of these precision predictors and interventions that impact children, families, and then have ongoing impact into adulthood. At the same time, I want to recognize that Pediatrics will also benefit, the field of pediatrics and the community pediatrics will benefit from all of us. We have something to give. And we recognize that in the scientific community, particularly in pediatrics, observational studies have been fueling much of the most impactful pediatric research over many decades. Things that are practice changing often either stem from or even completely live out their research life in observational studies. We know that having a data set like what you've heard has been described for the adult component of all of us that's accessible and research ready will accelerate future discoveries. And the many different types of data that we're able to obtain will catalyze a deeper understanding of pediatric health and disease. And so it's really a two-way street where we see that including peds is good for all of us, and we think all of us can be good for peds. Next slide, please. So I started with the program about 1.5 years ago, but it's important to note that there's always been an intention as well as a plan and ongoing activities to support pediatric participation in this program. So from the beginning, there have been a series of foundational steps that happened before I even started with the program to help lay out the path for pediatric inclusion in the program. As an example of that, the Pediatric Operational Task Force, which met in 2018, laid out an approach to starting enrollment with 3 different phases, allowing the program to focus on one age group at a time. That would then serially build on each other and end at the end of phase 3 with the program truly being open to all ages. That structure and that approach is one that we are enacting now under my leadership and with the teamwork across the whole program, starting with phase 1, building out the protocol, enabling us to enroll children from birth through 4 years of age. And starting with that age group will allow us to have the longest follow-up for that group of young people who enroll. And we'll build from there until we truly have enrollment open to all. If we go to the next slide, I want to highlight that although there's all this work that was done in the years leading up to 2022 and leading up to 2023, in 2023, enabling pediatric participation was the #1 priority for the research program. We'll go to the next slide, please. And in that year of 2023, we made enormous progress towards being ready for a pediatric launch. And I'm not seeing the next slide yet, but I'm going to keep rolling. And hopefully that next slide can come up in just a moment. Let me tell you about some of the things we were able to accomplish in 2023. After I started, I was able to build the pediatric team, establish a pediatric branch. We then got right to work at building the pediatric protocol, which is an enormous amount of work. We had to build a supplemental protocol, as well as either write or append 19 different appendices to the protocol to be ready for pediatric enrollment. We did all of that, got that all through the IRB. At the end of the year, in December of 2023, we had IRB approval to start enrolling children in that youngest age group. Then, concurrent to all that, rather than waiting for IRB approval, we actually worked with all of our partners in order to build out all of our enrollment platforms, our technologies, both participant facing and staff facing, so that would be ready. We built that concurrently so that it was tech ready to go in the middle of December, shortly after we had IRB approval. We identified sites that are already enrolling adults in the program who had pediatric expertise already. Many of them, like Dr. Harris-Williams, have been chomping at the bit for pediatrics to go live. And we selected just a few sites to do what we called an end-to-end readiness assessment. And I'll tell you a little bit more about that in a minute. But long story short, by the end of 2023, we had gone live with our pediatric end-to-end assessment with the goal of enrolling a small number of pediatric participants and then to get feedback. Again, this listening is baked into the program. We wanted to get feedback from families and feedback from staff and from the sites to make sure everything that we built was scalable and going to work well. And with that, I would go to the next slide, which has a map of the United States on it, if it's available. There we go. So this is that end-to-end readiness assessment that I spoke of. So we had 5 existing partner sites that were scattered about the country, and we had the goal of enrolling 1 to 5 participants at each of these sites followed by an intentional pause to look at how things went. I'm happy to say that we were able to start this in December of 2023. So those first enrollments came through, and we paused the enrollment part of this as intended and as planned in February of 2024, this year. And then subsequently, we went back, spoke to all the folks who were involved and got excellent feedback. There are some little tweaks that we need to make to move forward. We were able to get those done. But thankfully, this was a very successful test of all of our systems, and everyone was really excited to move forward. I have a little bit of a speed bump to share with you next, though. It's not always easy to do pediatric research. For those of you who have been in this field for a number of years, you may see this familiar story. In that then in April of this year, we received our budget for the program for financial year 2024, which is right now. And what we're showing here in these dark and light blue bars are the components of the All of Us budget. And what I really want you to focus in on is that last light blue, dark blue bar with the We Are Here dot above it is significantly smaller than last year's budget. So we have a 34% cut right now compared to what we had the last fiscal year. So this is enormously difficult to operate in the way that we have been doing high quality work with a much smaller funding bucket. What's even more concerning is if we look forward, the next financial year will start in October for the federal government. And there's a very wide range of projections. If Congress does not act and change our budget allocation starting in October, then compared to last year, next year's budget would be a 71% cut. So almost $400 million less than what we were operating at before. This is a really significant hurdle for us to overcome. Let's go to the next slide. You can read more about this, the perspectives on this on our website. This is a screenshot from our website posting from April of this year. The highlighting on the screen is mine to highlight some of the things that are relevant to today's conversation. So specifically that with this change in our budget scenario and this uncertain forecast for the future, that this means that we need to delay the launch of pediatric enrollment and a slowing of new data collection in general for the program. So it's not just pediatrics that's affected, it's all data collection across all age groups and all data types, really. At the same time, Dr. Josh Jenny, who's our CEO for the program, wants us to maintain momentum to build the program's ability to be able to do all things that we do well, including to include pediatric participants in the future. And so if we go to the next slide, I just want to highlight some of the things that we are still doing, even in the face of this uncertainty, how we are maintaining momentum and how we are moving forward in this current climate. So despite this delay in the launch of pediatric enrollment, the thing we had planned to do, we are still preparing. We are further developing the protocol and working on future pediatric enrollment across all age groups. So specifically, our next task on this is to work on the next age group of kids, those primary school age kids, so that we can be ready when enrollment becomes a possibility. We are also continuing to engage with our pediatric communities, including this one, as well as parents, healthcare providers, researchers for input and support, because we want to make sure we hear from you. And we want to energize you. We want to educate key partners about the value of the program, the potential that we have moving forward, and how much of an impact we can have in the event of stable funding, when we'll be ready to launch pediatrics and really ready to move forward. And so with that, that concludes my remarks, and let me hand it back to the meeting organizers to take us forward in the conversation.
Great, thank you very much, Dr. Vandries. And Dr. Williams, did you have more information you wanted to present at this time?
No, I don't. I'll participate in the panel discussion.
Great. So I'm thrilled with that overview that you both gave. And as I mentioned, I'm Dr. Winston Price. I'm a CTIO for the W. Montague Cobb Institute. And we've been involved with the since to partner during the community positions into important of our in the population. Important the fact that mentioned underrepresented in research. 14% of individuals are from the community, and 20% of that population are from the Latinx community. So it's a tremendous opportunity for us to bring those individuals into the All of Us research program. And so for our astute panel, I'd like to go ahead and, are you hearing me still? Yeah, I'd like to bring in our panelist, Dr. Rachel Chatters. And with your extensive experience, as a pediatrician in private practice for over 25 years, providing both inpatient and outpatient care to children from birth to older adolescents in rural Louisiana, and as an immediate past president of the Louisiana chapter of the American Academy of Pediatrics, how has research influenced the care you have provided over the years, Dr. Chatters?
Thank you. I'll be glad to share. I'll just mention that I am in solo private practice in the CatchNet area that I serve is very rural, and often people have well water and are having housing issues, transportation issues, access issues, all of those things. So to give good care, we have to include all of that and identify those things and how those things affect the patients in their overall health, their overall well-being, and their ability to be successful in whatever they're doing, including for children. And the research processes actually directly influenced and improved the care that I provided to my patients over these years. Obviously, evidence-based medicine, guides me in making clinical decisions that support the rigorous scientific evidence as opposed to just anecdotal experience alone. And this ensures that I provide care based on the most current, reliable information available. The evidence-based medicine, along with clinical guidelines, help to keep some consistency and high-quality care for our patients. And also advancements in treatment have led us to improve everything from chronic condition management, neonatal care, pediatric oncology, infectious disease, all of that. I can give multiple examples. I can tell you that my 25th year in practice here will be, anniversary is July 19th. And I can just give an example that asthma care has changed unlimited number of times over 25 years. We just had new protocols, and that is based on some evidence. And I think that people are now just waking up to an idea that they probably already knew, but just didn't act on, that a lot of these conditions all begin, at the beginning of all the life processes, which has to include pediatrics. And so we're checking cholesterol at 10 as an average thing, as a recommendation, because we know that these children, if you're obese by 3 years old, your adulthood would be challenged by that over 80% or so. So we have a lot of things that is evidence-based that helps us with not just advancements in treatment, but in preventative care strategies, such as immunization schedules, screening protocols, early intervention programs, and implementing these strategies has been essential in promoting health and well-being of children under my care and all pediatricians. Also, understanding disease pathology. We have to start with including some pediatric patients in these evidence-based programs, because we need better accuracy in diagnosis and in optimal management. And so, just for instance, advances in cystic fibrosis here lately have greatly changed our care of pediatric patients. The new advances in sickle cell disease, and I'm simply mentioning the new medicines available, and that involves research. That involves including pediatricians and pediatric patients in that research, so that they can get that advancement early on. Also, patient education is directly linked to research processes. We need to inform our families of the new advancements and have them prepare for these changes and be willing to participate in developing advances. And lastly, I'll say that the quality improvement initiatives have been greatly influenced by research outcomes. Everything from food insecurity to access to care to the ACEs and how they affect the health and well-being of our patients is all relative to information that came out of research processes. So overall, I feel research is probably the most instrumental thing in shaping the practice of pediatric medicine for me. And so I'd like to see it be more paramount in the overall research programs out there that are directly influencing our youngest citizens, our poorest citizens. And I think that with all of that, we can get better support for dissemination of these findings and will ultimately benefit pediatric healthcare in general.
Thank you, Dr. Chatters. And just to reemphasize again, 73 million individuals, 26% of whom are Latinx, 14% who are Black. And we know that there are a host of disease conditions. You mentioned one in terms of asthma that impacts proportions disproportionately in those individuals. And the social determinants of poor health outcomes certainly play a significant role in that regard. And still, despite all of the wealth that we have in America, there's still about 6% of individuals who are uninsured. And until all of the states enact a public option, even those who have public health insurance, there are a number of individuals who have inadequate insurance to deal with all of the health conditions that you mentioned. And certainly key to that is how we bring our health workforce up to the level that it needs to be to address these concerns. And so that's why I'm so thrilled that Dr. Abazi has joined us. Dr. Abazi, you're in your second year of pediatric residency, and I'd like to know, what are your thoughts on pediatric research, and how would increasing opportunities for residents to access the research data enhance your educational experience in medical training?
Thank you for having me. It's a pleasure to be here. I just want to come behind Dr. Chatters in her conversation about the importance of pediatric research, because we often say children are our tomorrow, but the question I would ask is, what's our today? Like, to be able to have a good assessment of who are we treating today? What are the conditions that are going on? As far as the data goes, that's what's going to help our tomorrow. And so I think the exposure definitely is important. As far as just generally the importance of pediatric research is that trainees are exposed to the research, trainees are exposed to the data to help us as it relates to evidence-based medicine and having more confidence when it comes to our interface with diagnosis and management, simply just by building up our exposure. A lot of trainees from a resident standpoint, and certainly medical students as well, may not even be able to see a lot of different conditions in their practice. And so simply being able to have access to research from a broad and diverse pediatric population population helps not only from an educational standpoint, but helps our actual training for wherever we end up going, when we do serve those populations near and far. So definitely pediatric research is not only important, but I would say it's necessary from a trainee perspective to have a holistic training and to have the confidence to be able to provide care for the children who are our tomorrow.
Thank you. And as you're all aware, the issues that befall certain populations at risk span all the way from preterm birth and low birth weight, infant mortality, emotional and behavioral difficulties, adolescent depression, disabilities, diet quality, obesity, food deserts, asthma, and the one that has raised its ugly head in the last several years is gun violence and suicide. And so we need to ask the right questions, and we need to get the detailed answers, and certainly getting sensitized trainees coming out of the medical programs and nursing programs, pharmacy programs, and public health. We can begin to use that data effectively, as you say, by analyzing children early and finding those conditions that lead to chronic illnesses. And, individuals like Dr. Williams, who has been through the academic and clinical side of medicine and has the research experience, we are thrilled that you're and all of us pediatric champion. And would like to know what drives your passion for all of us, and how could all of us fuel healthcare advances, both in the academic and the clinical pediatric milieu?
Thank you for that question. Just like you said, and just to also reiterate what Dr. Abazi and Dr. Chatters had to say about the advances in pediatric medicine as a result of research, it's so important that pediatric patients are involved and pediatric participants are involved in research to help us provide the best care possible to our patients and their families. For me, I think back to receiving a call about my sister having pleurisy and going to the hospital, and then just one thing after the next. So from a personal standpoint, it's personal to me because after several hospital visits, acute renal failure, diagnosed with lupus, I look back at my family history and I see a lot of autoimmune disease that we never connected the dots. And so I know that research connects those dots. It provides an opportunity to, one, understand your history and to understand those risks and to understand how to prevent disease. And so for me, it's personal. And also from a maternal health perspective, I lost a friend who had passed away after giving birth to her third child. And she left a newborn home with two other kids who were under the age of 7. And so it's very important for our populations to be involved in research, especially pediatrics. So that's a personal part for me. From a professional standpoint, I see kids who are a part of communities who need help. The parents need help understanding their disease processes. The providers need help understanding how to treat these disease processes. And all of the advances help us as a community of physicians, as a community of providers, to provide better care for our patients based on evidence-based medicine. From the standpoint of an academic physician, I see a huge gap as it relates to training pediatricians and exposing them to the importance of research on the front lines. I think all of us can provide data for these trainees who are in those fields to get a little sense of what research is all about. And I love the Research Scholars Program. I served as on the advisory board for the Research Scholars Program that all of us had. We offer that program to high school students, to undergraduate students, to graduate students, professional students, to have access to the data and to answer questions that they may have questions to, research questions, scientific questions. And they were able to access that data and to do a research project. And we provided mentors for them. So it's so important for trainees, residents, to be exposed to research and to allow that to be a part of their practice. And so I just see the benefit in so many different areas, from a personal standpoint for me as a health advocate, from a clinical standpoint as a practicing pediatrician, and from an academic standpoint as a trainer, training pediatricians to practice medicine.
Great, thank you very much. And certainly the pandemic forced a lot of research out of the woodwork in terms of trying to find acute answers. But we know we still have a long way to go with regard to the pediatric population. So I'm going to throw out to all of the panelists, and you can jump in to respond to the question. We know the difficulty in terms of getting underrepresented individuals and populations involved in clinical research and even population research. And so what unique approaches do you think we can take with regard to convincing not only the parents, but also convincing children to get involved in this research project to engage the pediatric population? Anyone?
I would say that it probably is needs to be started with a clear education about the importance of research for their children, for their children's future, for future generations, etc. I'm just going to share one thing. When I finished residency, or when I finished medical school, I'm not sure exactly what part. My grandmother, who didn't have very much education, when I was explaining to her that I was going to be doing pediatrics, she just told me, "Oh, you need to study a little more so you can take care of me later," So, and that is, I think, what a lot of the communities feel, that they may not distinguish that pediatrics, they're not just little adults or little people. That's a whole separate population that we need to address in our research. And I think that a lot of times our communities don't understand that and everything. They feel, oh, it'll just extrapolate down. And that is not necessarily the case at all. And so I think they need to be educated on their important role in advancing healthcare and everything. I think we have to start with that, because I think many of them think like my grandmother on that.
Thank you.
I hear you,
Yeah.
Dr. Chatters. If I could comment, I think one thought I have is I think young people sometimes, even I as a pediatrician, underestimate them. Right? I remember when my oldest daughter, who's now an adult, was in I think she was in kindergarten, first grade. A paper came out in the journal Pediatrics, if I recall correctly, that showed how by giving the varicella vaccine to children at 12 months of age, we saw decreases in varicella adverse events in children under 1 year of age. And I showed her the graph when she was just a little young person. And I said, look, the kids do better, even the ones who didn't get the vaccine. And I tell you, even now, when she goes and gets in shots, she rolls up her sleeves and says, time to save some babies, because she took it to heart, that she understood herd immunity from that little conversation that we had. So all of that is research-based, right? Like, we have to get the data to prove that it's working, to make sure we're doing the right thing for kids. And so, I think explaining it in ways that even our pediatric patients can understand will help us out a lot. And I think it starts with healthcare providers. All healthcare providers are trusted sources of information. And if healthcare providers can say, you know what, research is really important. It's going to help me take care of you and future you. That's going to really help not just the All of Us research program, but pediatric research in general, be able to have those trusted relationships in the community with healthcare providers and other community members who people go to for advice.
And I think we have to not
Go ahead.
I'm sorry. Go on. I was just going to say, I think we
That's
have
okay.
to make sure that we don't forget about some concerns in history with research and how it affected minorities and poor families and other people who may have some various disparities. I mean, we were not honest with them. We're not forthcoming. Did not explain well. Withholding, all of those terms. And I think people still harbor that. And we have to address it. We cannot put it away. We cannot put it aside and say this is a new time. We have to address it and go forward with honesty in our research approaches to people. And I think that will help with some of the fears associated with being in a research participation process.
Right. And certainly the trusted messenger who is engaging the community is an important facet to that. And the fact that we're still only 5% of the physician workforce and 6% of the dentist workforce, and same with pharmacy, nursing is struggling to train enough nurses. We will continue to have the barriers in terms of getting a trusted message out there so that people are not relying on the misinformation and disinformation with regard to past inequities. And yes, we are not going to forget our history, but it's important that we as learned individuals involved in research present an open face with regard to why this is a different day in terms of the research, and why the safeguards that are put in place with a program such as the All of Us research program is quite different from the things that occurred in the past. Yes, you were going to say something, Dr. Williams?
I think based on your previous question, trust is a big barrier. And like Dr. Van Drie said, we are building trust, and we build trust with the communities. We as providers, especially in the pediatric population, we build trust with our parents. We see kids a lot. And I think building that trust is vital with the providers that are out in communities, and letting the parents know that we're not just trying to find cures to disease now, but this program will find and provide cures for generations to come. This is not just for today. This is for the future of you and your family. And so that's why it's so important for them to learn and be educated about the importance of research and how it can impact not just them today, but for generations to come. And educating our pediatricians who are in training to understand the importance of educating their patients about the importance of research is very important. And so building that trust, we do that day in and day out. That's what we do as pediatricians. We build relationships with our patients. It's just who we are. It's just how we're built, and that's what we do. And so we're on the front lines with them. And so I think building that trust, letting them know about helping their family now and in the future will make a difference.
And we are not political, so we're not lobbying Congress directly. We work based on the science. What is it you think the individuals making decision about the funding, what is it they need that they're not hearing with regard to this program? Because the cost saving down the road in terms of the answers to critical chronic disease and to some of the more difficult ills that we're seeing even in the pediatric population will save the billions of dollars down the road. So what is it you think they need to hear to help them move the dial?
That's an excellent question, and one that we're certainly wrestling with. You know, as a federal employee, I'm also not lobbying anyone, but we do want to educate. And I think one of the things that we know that our congresspeople that have had conversations with us have said is, number one, that some of them weren't aware that we, as all of us, hadn't enrolled children yet. They sort of assumed, perhaps understandably from the name of the program, that included everyone. And so they didn't realize that we had this really important work yet to do. And so I think that's a piece of it. I think, again, there's some people, though, that still think that, as Dr. Chatters alluded to, that if we just understand adults well enough, we'll get it right for the kids. And so making sure that everyone understands that kids are not small adults, that because of that, we need to devote time, attention, and study to this very special population to get it right. And making sure that that point is adequately expressed and from as many voices as possible will be just super excellent.
Great. Dr. Abazi, what do you need in terms of residency programs that will resonate with them?
I think from a resident standpoint, we often talk a lot about advocacy, and I think sometimes matters like this may feel really large and big, and it may feel like a large problem to even address from a trainee standpoint. But I think something that would be very beneficial is to answer the question of, what is my part to play as a resident? Where can I advocate for the patients that I am part of their care? And then I believe networking is a huge thing too. Many residents may not even know a lot about all of us. And so having that interface with residents where they are exposed to this specific program and have an opportunity to play a role from an advocacy standpoint will not only spread the word across different residency programs, but will help residents feel empowered to know that there is a role I can play when it comes to matters like this.
Well, we've had a tremendous discussion with regard to the pediatric engagement for the All of Us research program. And as the CTIO for the W. Montague Cobb NMA Health Institute, I certainly am thrilled. Also working as a pediatrician in rural America, I understand the importance of the benefits of this particular program. So as we begin to wrap up, 1 minute, 60 seconds, last comments, Dr. Mandris.
I just want to thank everyone for the opportunity to be here, especially from the panelists and Dr. Harris-Williams, Dr. Price. I want you to know that I jotted down notes. There are phrases that came out to me today, you know, things like connecting the dots and, you know, children are tomorrow, but where are we today? These are things that really hit home for me. Your thoughts about residents as advocates, as they learn about research, and again, those are dots that we're connecting. And so I encourage everyone, if you have further questions or things that you'd like to talk about all of us, you can always reach out to me. I'm easy to find on the internet, and my email is available. We want to work with partners who can help us get this done. We're ready to go. We just need a little bit of a one shot of epi here, and we'll be on our way.
Dr. Abazi, thank you.
Thank you so much for having me. This has been a pleasure to be a part of this panel. And I think coming from this, I feel encouraged. I'm encouraged that this conversation is being had and that there's work being done in this arena. And like I said, I believe that not only for the children that we're caring for, but even from a trainee standpoint, seeing that work is being done that involves a role that we can be a part of is encouraging. I think it does connect communities across the nation.
Great. And for Dr. Chatters?
I'm glad that we're talking about this so that we can move things forward to definitely include the pediatric discussion in all areas of research, because we all know that it's going to take a lot of time to get the pediatric research platform really on the level of the adult platform. And so I'm glad that this is a step in that direction. And I just want to say that a lot of times in terms of getting things moving, people don't want to talk about children being ill or talk about children struggling or children not having their needs met. And so sometimes this subject matter is just simply not discussed whatsoever, including having pediatric involvement in research discussions in terms of the need assessments. And I think that may influence funding, because people don't want to be sad in thinking about children being ill. Unfortunately, it can be as simple as that with that. In our struggles, when in my role, I'm immediate past president of the Louisiana chapter of the AAP currently, but as chapter president for quite 2 terms, I can tell you that much of our processes involve just getting the legislature in our state aware of various things that involve pediatrics. And I can tell you there were so many times they just said, "Oh, we're getting over COVID. We just don't want to. We need a happy discussion." And so a happy outcome is our happy discussions, and that involves getting the research in place to provide that happy discussion.
Great. Thank you, Dr. Chatters. And as we round out with Dr. Williams, we're going to throw the survey up that our participants can scan the code and answer. And while you are doing that particular survey, we'll go ahead and hear from Dr. Williams to close us out.
Well, thank you all. Thank you to Dr. Watson for being on. Dr. Vandries, thank you so much for being on and speaking. I want to thank Dr. Morgan for having this webinar. Thank you to blackdoctor.org for hosting. And thank you to you, Dr. Price, for being our astute moderator tonight. Dr. Chatters, Dr. Abizi, and Dr. I said Dr. Vandries already, but thank you all for being on tonight. All of us is so important, and it's important for the future of our future health. It's going to improve health outcomes for all families, for generations to come. And I'm just passionate about the program from a personal, from a professional, from an advocacy standpoint. I see the change that's possible. And I hope that you all see the change as well, and excited about the pediatric protocol and looking forward to continuing the work that we've started.
Thank you so much. And thank you, my panel, and also blackdoctors.org. Please check their Facebook and also their YouTube site. There'll be additional very informative videos and webinars that you'll have. So thank you again, and thank you everybody for your participation. Good night.